Welcome to this explainer. If you're prepping for your clinical exams, well, you already know just how intimidating the pediatric growth station can be, right? Today, we're diving into a comprehensive deep learning for your CCE exam to simplify the whole shebang. And to really make these concepts stick, we're going to be using some cute professional illustrations to anchor your memory. Think of our pediatric case today, let's call her Ruby, like a small plant. To thrive, she needs the exact right environment, the right nutrients, and the right care. If she's not growing, our job isn't to judge, it's to investigate the soil and the sunlight. So here's our clinical workflow. We'll start by meeting Ruby and looking at growth faltering. Then we'll organize our 4 diagnosis buckets and establish the Growth 6 Safe Exam Framework. After that, we'll cover clinic management, navigate specific social contexts, and finally, build your 90-second exam script. Let's get to it. All right, Section 1. Meet Ruby and the concept of growth faltering. We kick things off at the chart reading station. Here, your absolute first task is distinguishing a child who is just naturally small from a child who is truly failing to grow. You see, the examiner doesn't want you to just recite a textbook list of 50 causes for poor growth. No way. They want to see that you can accurately interpret serial measurements. If Ruby's weight drops from around the 50th centile all the way down to below the 3rd centile and her length drops too, that is true growth faltering. It's not just an isolated bad weigh-in, it's a significant clinical trajectory that absolutely demands your attention. Now, when the examiner asks for your diagnosis, this statement is your high-scoring, balanced one-line answer. Why is it so effective? Well, because it names the most likely culprit, inadequate nutrition, while explicitly proving to the examiner that you haven't closed your mind to other red flags. You're stating clearly that you are looking out for malabsorption, vomiting, or chronic disease, but you're playing the statistical odds safely. When you actually present your chart findings, lean on the PLOT acronym to safely and effectively show you grasp the clinical significance of Ruby's trajectory. You plot on the chart, specifically referencing the Malaysian book record Kesihatan if you're in the clinic Kesihatan context. You look for crossing centiles. You observe the specific drop, and you state what this suggests. Using this exact structure shows the examiner you are a super observant, methodical clinician. Moving right along to Section 2, the 4 diagnosis buckets. Instead of overwhelming yourself with a massive, disorganized list of pediatric conditions, let's break your differential diagnosis down into 4 logical buckets. The crucial point here is that in kids under 2 years old, inadequate intake is the most likely driver. Grouping your differentials like this prevents cognitive overload. Bucket 1 is not enough intake. Think wrong formula prep or food insecurity. Bucket 2 is not absorbing, like celiac disease or chronic diarrhea. Bucket 3 is burning too much energy, stuff like congenital heart disease or chronic infections like TB. And bucket 4 is care and psychosocial factors, like maternal depression or poverty. Doing this shows the examiner you're a really safe, structured thinker. On to Section 3, our exam framework, which we call Growth Sick Safe. Next up, you step into the physical exam phase. And let me tell you, just saying I will do a general examination simply won't cut it in the CCE. By explicitly naming the Growth Sick and Safe framework, you're directly telling the examiner exactly what clinical clues and social determinants you are actively hunting for. For growth, you aren't just weighing them. You're checking oral and ENT for feeding difficulties, the tummy for organomegaly, and neuro for swallowing safety. For sick, you're hunting for hidden infections. And crucially, for safe, you're observing parent-child interactions, hygiene, and bruises to rule out neglect. It's a completely holistic sweep. That brings us to Section 4, Management in the Clinic. Once you've got your diagnosis and exam findings locked in, it's time to build a safe, practical management plan. The step-by-step roadmap is your action plan for the outpatient setting. Notice how we prioritize optimizing the child's feed and scheduling a safety net follow-up before even thinking about ordering expensive lab tests. Step 2 is absolutely vital. You must ask about the exact 24-hour diet recall and the specific formula scoop-to-water ratio. Wrong dilution is a classic CCE trap. Then you build a practical plan, like adding a teaspoon of oil to thick boober nasi, and set a firm 1 to 4 week follow-up. I really highly recommend you just memorize this exact phrasing. The examiner is heavily scoring your empathy and your ability to partner with the mother without casting blame. Saying something like, "This does not mean you cared for her wrongly. Many babies experience this, and we can start a clear nutrition plan," instantly diffuses the parent's anxiety. A quick tip: never use the harsh phrase "failure to thrive" directly to a mother. Just use slow weight gain and explain it kindly. Now, what if they throw you a curveball follow-up question about a 16-month-old fussy eater? You can use the what, when, where, and how much framework to normalize toddler independence. The parent decides the what, when, and where, but the child absolutely decides the how much. You want to advise them to avoid mealtime wars, avoid screen time, and remember to tell the parent that it can literally take 10 to 15 tries before a toddler accepts a new food. Let's look at Section 5, Navigating Specific Social Contexts. A major trap in the CCE is how you handle specific demographic contexts, whether that involves indigenous communities, rural estates, or disadvantaged urban populations. Examiners value cultural humility above almost everything else in this station. Your focus has to remain entirely on actionable social determinants and culturally safe care. Do not generalize about a family's capability to feed their child. Instead, talk about distance to the clinic, the cost of formula, or access to clean water. You want to explicitly state to the examiner, I would explore barriers and support the family. So here's that major trap laid bare: blaming culture or poverty, or conversely, ignoring the social history entirely and ordering a massive panel of rare genetic blood tests when the child is otherwise completely well. The high-scoring candidate explores barriers respectfully, optimizes feeding first, and only targets investigations like a full blood count, urine culture, or thyroid test if there are clinical red flags or if the child just fails to respond to the nutritional plan. Finally, Section 6, your 90-second exam script. We've gathered all the pieces of our clinical puzzle, and now it's time to synthesize it all into your final presentation. You should rehearse this comprehensive 90-second script repeatedly. It perfectly packages your chart reading, your balance differential, your targeted exam findings, and your safety net plan into one smooth delivery. You state the diagnosis, assure the examiner you're checking for red flags across multiple systems, explain the non-judgmental counseling, and lay out a clear monitoring timeline. It shows total, absolute competence. But hey, let's be honest for a second. Exam stress is very real. What if panic sets in? What if you sit down opposite the examiner, look at that growth chart, and suddenly forget your long, perfectly rehearsed scripts? You're going to need a mental emergency parachute to show the examiner you're still a safe clinician. If you freeze up, just take a deep breath, look at the examiner, and give them the mind block rescue. Tell them, I will plot growth correctly serially, I will protect from red flags and safeguarding issues, I will feed with practical, age-appropriate nutrition, and I will follow up safely with a multidisciplinary safety net. It's a flawless summary that proves you have totally mastered the essentials of this explainer. So ask yourself, next time you look at a faltering growth chart, are you going to get lost in a list of 50 rare diseases, or are you going to protect, feed, and follow up? Keep that in mind, and you'll do absolutely great.